Hey everyone! Before we dive in, quick request. If you find this useful, please subscribe to the channel, hit like on this episode, and tell us in the comments what topic you want next. It really helps us help you. Today we're speed revising foundational definitions across community medicine, perfect for MD exam as well as third year MBBS VIVA. Joining us is our resident expert, Dr. Joshi. Ready?
Absolutely. Let's move chapter by chapter and anchor each term with quick cues you can reproduce in exams.
Great! Starting with Man and Medicine towards Health for All. What exactly is community medicine?
Community medicine is that specialty dealing with populations. It includes doctors who measure population needs, both sick and well, plan and administer services to meet those needs, and those engaged in research and teaching in the field.
And the classic Health for All target?
Health for all meant that by the year 2000, all citizens should attain a level of health that permits socially and economically productive lives.
Define healthcare, primary healthcare from Alma-Ata, public health, preventive medicine, and hygiene. Rapid fire.
Healthcare is the multitude of services to individuals, families, or communities by health services or professions to promote, maintain, monitor, or restore health. Primary healthcare per Alma-Ata is essential healthcare based on practical, scientifically sound, socially acceptable methods and technology, universally accessible with full community participation, affordable to sustain at every stage of development, in the spirit of self-determination. Public health is the organized application of local, state, national, and international resources to achieve health for all. Preventive medicine includes organized community activities to prevent occurrence and progression of disease and disability, mental and physical, and timely use of all means including prophylaxis and health education, like the work of a good doctor caring for individuals and families. Hygiene is the science of health and embraces all factors contributing to healthful living.
Now, concept of health and disease. Give me the core definitions.
Health per WHO is a state of complete physical, mental and social well-being and not merely absence of disease or infirmity. An operational definition of health is adequate functioning of the human organism in given genetic or environmental conditions. Disease per Webster is impairment of body structure or function, mediating health, a departure from health, altering vital functions. Ecologically, disease is maladjustment of the human organism to the environment. Positive health is where every cell and organ works at optimum capacity in perfect harmony. Crude death rate is the number of deaths per 1,000 population per year in a given community. Case fatality rate measures the risk of persons dying from a certain disease within a given time period.
Pause and recall. Can you contrast crude death rate with case fatality rate? New chapter. Principles of Epidemiology. Start with epidemiology itself.
Epidemiology is the study of occurrence and distribution of health-related events, states and processes in specified populations, including determinants and their application to control health problems.
Differentiate monitoring and surveillance.
Monitoring is routine performance and analysis of measurements to detect changes in environment or population health status. Surveillance is systematic, continuous collection, analysis and interpretation of data, closely integrated with dissemination and assessment for timely action.
Define prevalence, population at risk, infection, and hospital-acquired infections.
Disease prevalence is total individuals who have a disease at a particular time divided by the population at risk. Population at risk only includes those capable of having or acquiring the disease. Infection is entry and development or multiplication of an infectious agent in an organism. A nosocomial infection originates in a patient while in the hospital or healthcare facility.
And the 3 carrier states?
Incubatory carriers shed the agent during the incubation period. Convalescent carriers continue to shed during convalescence. Healthy carriers have subclinical infection, no overt disease, yet shed the agent.
Case Vignette 1. A block reports fever cases rising among school children. Lab still pending. What do you initiate and what terms apply?
Start monitoring to track routine changes, set up surveillance for continuous systematic data with rapid dissemination for action, define the population at risk, for example, enrolled students, estimate point prevalence and watch for incubatory carriers in early transmission.
Now, screening.
The iceberg phenomenon reminds us most disease in the community is hidden with only a small visible portion. Screening is searching for unrecognized disease or defect by rapid tests or examinations in apparently healthy individuals. Case finding uses tests to detect disease in those seeking care for other reasons. Diagnostic tests confirm or refute disease using clinical or laboratory procedures. Validity is the extent to which a test accurately measures what it purports to measure.
Chapter of Communicable Diseases focus definitions which can be used to other diseases as well.
Malaria control means reducing malaria burden so that it is no longer a public health problem. Malaria elimination is interruption of local mosquito-borne transmission with zero incidence in a defined area. Annual parasite incidence (API) is confirmed cases during 1 year divided by population under surveillance multiplied by 1000. A case of leprosy is a person showing clinical signs who has not yet completed multi-drug therapy. Paucibacillary leprosy is 1 to 5 skin lesions and or 1 nerve involvement.
Now, on to chronic non-communicable definitions.
A chronic disease is an impairment of bodily structure or function that modifies normal life and persists over time. Hypertension is classified essential when causes are generally unknown. Obesity is abnormal growth of adipose tissue from increased cell size or number. Blindness per WHO is visual acuity less than 3 by 60 on Snellen. Oral health is being free from chronic oral and facial pain, oral cancer, infections, and disorders limiting oral or psychosocial function.
Let's move on to system reforms.
A health and wellness center is envisioned by National Health Policy 2017 as the foundation of India's healthcare system. Universal health coverage (UHC) ensures equitable access to quality health services for all citizens regardless of socio-economic factors.
Let's talk about global goals and demography.
SDG 3 is to ensure healthy lives and promote well-being for all ages. A literate person can read and write with understanding in any language. Crude literacy rate uses total population as the denominator. Effective literacy rate uses population aged 7 years and above as the denominator.
Now, chapter of Preventive Medicine in Obstetrics, Pediatrics and Geriatrics.
Growth is increase in physical size. Development is increase in skills and functions. Preschool age is 1 to 4 years. A risk approach in maternal and child health is a managerial tool focusing care on those in most need. Perinatal mortality rate per WHO is late fetal plus early neonatal deaths divided by live births plus late fetal deaths multiplied by 1000. Neonatal deaths occur within the first 28 completed days. Neonatal mortality rate is neonatal deaths per 1000 live births in a year. ICF by WHO classifies functioning and disability associated with health conditions.
Next chapter, Nutrition.
Nutrition is the science of food and its relationship to health. A nutrient is a specific dietary constituent such as protein, vitamin or mineral. Dietetics is the practical application of nutrition principles. Good nutrition is a status that enables good growth and health. A problem village lacks safe water or water is excessively deep, saline or contaminated.
Next chapter, Environment and Health.
A water carriage system collects and transports human excreta and wastewater via sewers. Disposal by dilution means disposal into watercourses. The Bangalore method is an anaerobic composting system using a hot fermentation process.
Now, Occupational Health Essentials.
A factory is an establishment employing 10 or more workers with power or 20 or more without power. A worker per the 1976 amendment includes contract labor in the manufacturing process. Creatures are required in every factory employing 30 or more women workers. A welfare officer is required in factories with 500 or more workers. The Employee State Insurance (ESI) Act coverage includes all employees earning less than or equal to Rs 21,000 per month as of 6/9/2016.
Now, Genetics and Health.
Prenatal diagnosis uses amniocentesis at 14 to 16 weeks to diagnose chromosomal anomalies or metabolic errors.
Now, something from Mental Health and Substances.
Heroin is a narcotic analgesic producing strong addiction and craving. LSD is lysergic acid diethylamide, a hallucinogenic compound discovered in 1938.
Now, Communication for Health Education.
Health education is continuous evaluation of activities aimed at improving knowledge, attitude and behavior. Group discussion is face-to-face interaction towards a common goal. A symposium is a series of brief speeches on a selected topic. A workshop is a series of meetings emphasizing individual work with expert guidance. Encouragement in an interview uses expressions to positively reinforce interviewee participation.
Finally, Health Planning and Management.
Universal health coverage, same definition as earlier, ensuring equitable access to quality services for all citizens. A Type A primary health center is a primary health center with fewer than 20 deliveries per month, and Type B with 20 or more deliveries.
That was dense and beautifully exam ready. Dr. Joshi, if this helped, subscribe, like, and drop your next requested topic below. See you in the next episode.